Bismillah Rahman Rahim. Today we will do a very short and basic talk on hypertension bleed inside the brain. Okay. First focus, there are three images, and the most common site for hypertension bleed are three most common site. The number one is the head of the cardiac nucleus or lentiform nucleus. Okay, it's basal ganglia. Number one site that is most common site for the hypertension bleed. Okay, number two site is the brainstem. Okay, brainstem is the also very common site for hypertension bleed. And number three site is the dentate nucleus. You can appreciate this gray curved semi-lunar structure on either side of the superior aspect of the fourth ventricle. This is these are posterolateral structure, curved structure of gray matter nucleus. Okay, and this is also most common site. Now let's see some example. In this case, the first case, this is the, you can appreciate that there is bleed inside the lentiform nucleus, and you can also appreciate that very little surrounding edema, and the shape of the bleed is lobulated shape. Okay, and you can also appreciate some foci of blood also in the occipital horn of left lateral ventricle. This is the extension of the bleed, and in this case you can see that this is the bleed in the pons, that is the brainstem. Okay, and third is the example is the dentate nucleus bleed. You can appreciate a bleed in the left sided dentate nucleus. Okay, these are most common site for hypertension bleed. And also I also some points I am giving you, some points that will favor the hypertension bleed, that are the hypertension bleed. There will always be very little edema, very little surrounding edema. You can appreciate the size of the bleed is very large, but very little surrounding edema. Okay, this is the basic thought process for the hypertension bleed. The second thing is the hypertension bleed is lobular shape. You can appreciate this is the lobular shape. Okay, and if the bleed is present in the lobar, cerebral lobar, in any lobe of the brain, and if it is circular, if it is in circular form, and with extensive surrounding edema, then we will think about some metastasis process or some underlying pathology, underlying primary mass lesion, because in that case there will be bleed will be rounded and extensive edema, and the site will be any lobe, not the basal ganglia. Okay, so these points favor, number one that favor its hypertension bleed is the location, three common locations. Number two that favor hypertension bleed is the very little or less amount of edema. Okay, number three that favor the hypertension bleed is lobular shape, it's lobular shape. Okay, one point also I want to share you, that whenever you see hypertension bleed, always see its extension into the ventricle. As in this case, you can see in right side there is also some level is seen, and whenever you see an extension of the hypertension bleed into the ventricle, this show poor prognosis, because The reason behind is that when the reason is that when there is no extension of the bleed into the intraventricular, then there is normal brain tissue tamponade this hematoma. Okay, but when there is extension of this hematoma into the ventricular, then the tamponade of the brain parenchyma to retain this hematoma on its original site is lost. When there is loss of tamponade, then there will be continuously bleeding into the ventricle, and when you know that when bleed in the ventricle, that what will happen, this bleed will cause impair the process of normal absorption of the CSF, then there will be hydrocephalus. Okay, and continuous bleeding will be into the ventricle system, and this sign will be a poor prognosis. And one point more for poor prognosis, the increase of size of the bleed. Okay, and in that case you will also see a swirl sign, an active bleed that will be in the form of some hypodense focus. In this case you can appreciate that this is the some little small dot hypodense spot, and with the passage of time this bleed size increased. So this is the swirl sign of active bleed. This is also the poor prognostic factor. Okay, hopefully you will understand these basic points. Thank you very much.